Okay. All right. So Ananda came to me the other day, and she had some concerns about her hair, particularly in the center area. She's been, well, you recently cut your.
I did the big chop.
Did the big chop recently, and when did you discover that you had this area that wouldn't grow?
So like 2 weeks after the big chop, it kind of started to thin out, not balding, but just thinning out. So I kind of realized, like, the rest of my hair was good at least. I was like, what's going on?
So a lot of times the problem for hair loss is, have you gotten relaxers?
I did.
As a youth?
Yeah.
So relaxers can be damaging. And I always tell people, your skin and your hair is like grass and soil.
Mm-hmm.
If you damage the soil, the grass doesn't grow. You drive over your grass every morning, sooner or later the grass kind of falls out, or kind of the grass dies off. So the problem with the top of the scalp is when you do relaxers, and correct me if I'm wrong, you do the relaxer, you start from the top and you kind of work your way back down, right? So, and you're supposed to leave it on for what, 10 minutes?
People leave it on for like 30.
So think about that though, and the limit is 10 minutes. Let's say it's 10 minutes. You're starting here and it takes you 10 minutes to do your relaxer, you end here. And then you leave it on for 10 minutes. How long has it been here?
20.
Exactly. So this is a spot that most black women have, and that's the reason why. So the other part is your body has a healing process, and that healing process is your skin's ability to heal itself. So every time you damage it with the relaxer, it has to heal. Well, the healing process deals with blood flow. And if your blood is not flowing to an area, it doesn't heal well. Well, gravity pulls your blood down. This is the area that's always going to heal the slowest in your body, okay? So when you damage this whole scalp area, this area is not getting enough blood to heal itself fast enough. So by the time 6 weeks comes again, you relax it again and you damage it again. So the crown is always the hardest part for most black women. They're always going to lose their hair in the crown. Well, that's why we naturally lose it there anyway. But the relaxer insulting it causes that biggest problem. So the damage came from there, and you can't really reverse scar tissue a lot of times.
See, I didn't think the hair follicles were dead because I see they're still there.
And they're not dead. They're just handicapped. So that's why you're getting the breakage. Yeah, so it's like they're literally handicapped.
Right.
So your hair follicles like to grow through it. My mom she loved flowers. She always taught me, if you plant a seed, you put the seed in the soil and you shove the dirt over it. You don't step on it. If you step on it, you pack it so tight that the seed can't push through. Well, that's what's happening with your scalp. It's basically your hair follicles like to grow through like this. They don't like to be squeezed off. And when you squeeze them off, they either die or they become handicapped. And therefore, you think about trying to grow handicapped, you're going to break off.
Yeah.
So that's mostly why most women have breakage in the top of their scalp.
Yeah.
So is that permanent or?
You can increase blood flow to it. You can do different things to decrease inflammation. It just depends on how long it's been damaged. You think of building a house, if your house is on fire and the fire department gets there in 5 minutes, they can save your house. But if it's been an hour, the whole house is burned down. So it's all a matter of time. So I always tell people that if you have an injury or insult to your scalp or a problem, the faster you can get attention to it, the better off.
That's what I always tell clients too.
Yeah, so that's the biggest thing.
A lot of clients don't even think to go to a dermatologist to see about hair.
Yeah, they don't. And we do a lot of different things. And your insurance pays for it. So you might as well go see a doctor, talk to them about your problem, and really have a set of questions to ask them when you talk to them. And they can give you some information. But also, I mean, you want to make sure you go to someone who kind of works with hair loss.
Yeah,
because
cares.
all dermatologists don't care about hair loss.
Right. You were talking about that, right?
Yes, we were talking about that. I think, so when my husband and I, we were getting ready to get married, I wanted to go to a dermatologist here in Charlotte and, check on my skin to see what was going on. And the end result, that dermatologist really didn't care. He was just wanting to prescribe me something really quickly, and I think it may have been like the wrong thing. And I realized that once I went to see Dr. Asbury a couple of years ago, that may not have been the first step that I should have taken in skincare. And that's important, to find someone who wants to really assess the situation and teach you how to be patient with certain things.
And have passion.
Have passion, because it's not an overnight thing. It's not gonna fix overnight, or at least it, it shouldn't be presented to you as such.
For me, because I see a lot of clients that have hair loss conditions, they're very passionate, and a lot of clients are heartbroken about their hair situation. So when they come to see, me or you, they want, some consideration of that, not just to like rush them off, but really just, understand not just that we're dealing with the situation, the hair loss situation, but helping them deal with it emotionally, and also, I always try to give them hope. There's always, something that we can do, so it's just, a matter of making them aware of it, and that's what you do, when they come. You talk to them and you tell them what it is and what options they have, because they think that they don't have any options sometimes, and they just deal with it. And I see clients of all ages with hair loss, and it's not just a relaxer.
And it's the same thing on my end. Is I get a lot of patients and literally I've got patients husbands who've never seen their hair. They go, yeah, my husband has never seen my hair. And I'm like, wait a minute, how long have you been married? What is that? How do you do that? So, and it's interesting, it's heartbreaking, and then for them to actually take their hair off and take their wig off, and you see what the problem is, and they feel like it's the worst thing in the world. And yeah, it's hand holding, and at times it's just about listening. So it's heartbreaking, but there are solutions, and you just you echoed everything I tell everybody in the room. And when I'm in the room with a patient, I explain to them that there is hope, there is something we can do, and if nothing else, I want them to get comfortable to understand and accept themselves first, and then accept your problem and say, hey, what options do I have? If it's a permanent problem, we can't correct the problem. What other options? And that's where you come in, because I send patients to you, and they come back and say, hey, Lisa had this for me, Lisa did that for me. So to usher people from there to there, it's it's a bigger problem than just the hair. It's pride, it's emotion, it's so many different things. So yeah, it's a big issue, and I think we need to address all those issues. But you need a provider that cares. And I remember what you're saying when you came, it was more or less of a conversation of, I got this thing going on, I'm about to get married, I'm about to do this, and those are important times in your life, and I think people need to take wind of that, and we've gotten so caught up in things that we don't care anymore. But there's some providers in Charlotte that care, and a lot of the people that work with us, they care about what your problem is, they're going to research it, and I get so many patients in my facility, in my office, my clinic, because my staff members care so much that they're like, you know what, I'm not used to dealing with black women in hair. I'm not gonna deal with that. Yeah. So what we end up doing, they end up sending them to me. So that's how I got to do what I'm doing, because I'm not afraid to talk to you straight. I'm gonna tell you exactly what I know, and if I don't know, I'm gonna research it. And I think that's probably the best thing that anybody can do, any profession. Find the solutions.
So let's go over some of the questions that we talked about that people might have.
So I think the biggest question is, does anybody know what alopecia is? Okay. Alopecia is just a word for hair loss. It covers so many different types. So you have drug-induced alopecia, where you take a medicine and causes your hair to fall out. You have alopecia areata, which is an immune system attack on your hair follicles, and your hair falls out in circular patches. You have scarring alopecia, which is what most black women end up having due to relaxers and chemical use. And that, don't quote me on that, because there's no research. They don't do the research. But the idea is that you have to look at the scalp when we do. We have to figure out what type of hair loss you have in order to, or what type of alopecia it is, to actually treat it. And that's the biggest question. Most people come and say, I have alopecia. What you gonna do about it? I'm like, we gotta figure out what type first. Everything's not going. It's not a blanket approach, and that's how we go work toward treating them. It's figuring out what type they have. We do scalp biopsies to figure that out.
Mm-hmm.
A scalp biopsy involves us getting a small piece of skin from the scalp, sending it to a lab outside of our office. They evaluate it within 7 to 10 days, and they tell us exactly what type of hair loss you have. You can have genetic alopecia. There's different types, and the goal is to figure out what type so we can fit the treatment with the type.
A lot of people have edges that they lose for different reasons, mostly because of styles, hairstyles, because, you know, most of our black women are wearing protective styles and things like that, and, you know, just not really understanding how damaging that can be. Can those be corrected?
They can. Those types are called traction alopecia, and usually it's seen mostly in patients who've had braids over and over again.
Yep.
And I always tell people, if it hurts, burns, or itches, get away from
That's
it.
what I tell them too.
That's in life too. So if your boyfriend hurt, burn, or itch, get away from it. Run. Yeah. They hurt, burn, or itch, run. That's what I tell people. So, but yeah, if it hurts, burns, or itches, stay away from it. Even if the braids are too tight, ask them politely. Don't get rude about it. Just ask politely. Hey, can you loosen these? Do these open? And it's because it's pulling on your scalp. You get traction alopecia. Throughout our lifetimes, of course, you get ponytails and all this other stuff that's pulling your hair away from your scalp. Even myself, I used to tie my hair up a lot, and that caused my edges to go. So the whole thing is just protective styles and being aware of that stuff. But genetically, it's going to happen. This area is always going to be the thinnest area, of course. So you can treat it if you, of course, again, if it's early.
Yep.
Yeah, so I guess with pregnancy, a lot of pregnant women may experience my particular story, I experienced a lot of hair growth, a lot of fullness, and probably 6 months to a year after I had my son, I experienced a lot of shedding, a lot of scary shedding, to the point where I thought, you know, wow, I have this wonderful baby here, but now his mommy is going bald, and it you know, it really brought me to tears when I came in to see Miss Lisa about the hair loss.
So that is, and that's a part of it. That's kind of a postpartum thing. It's actually an actual phenomenon I call telogen effluvium.
Wow.
Telogen effluvium is a specific condition in which your hair follicle, it's a harvesting issue. Your hair is in different phases and cycles. So the telogen phase is the phase where it rests and kind of goes quiet on you. Well, if that phase if it gets stuck in that phase after pregnancy or major surgeries or major depression issues, it'll get stuck in that phase. And during that time, your hair is not shedding. So your hair looks fuller than it really is. So when it really does go through the phase, gets back to that phase, it sheds twice as much as it would normally shed.
Wow.
So it's really a kind of a harvesting issue. It's like your scalp, you gotta think, if this is your hair that you're seeing, there's stuff happening up under here that you're not recognizing.
Okay.
So that's what's happening. It's the hidden stuff that's happening up under the skin.
Okay.
So that's a part of it, though.
So do you feel like as a hairstylist, how do I address my clients going into pregnancy to like kind of get them aware? Like I don't want to be like, girl, your hair gonna fall out. You know, like, because I mean it's an everyday issue that we deal with.
Yeah.
And as a stylist, how do I support them doing that? Like I can say a lot of things, you know, make sure we're, you know, being proactive because I know it's coming. You know, I try not to tell them that until they give birth because I know it's gonna scare them. I don't want to scare them and they're like, oh Lord. But like, how do I support my clients in that? Like, what do I do? Are there things that we can do?
Truth, just the truth. You tell them the truth and you do it on a client-to-client basis because the thing is everybody's hair doesn't fall out noticeably.
Yeah, that's what I know.
So most of them do.
From end to end, like legit. I've had a client who you just look like you just turned Persian, you know, and it's just beautiful. And I have had clients who have lost everything.
It all depends. And the thing is you have to take them as they come, and you basically inform them, like give them. I'd rather tell you up front than give you an excuse later why it happened. So up front, you just tell them, hey, this may happen. If it happens, we're going to do our best to take care of it. It's normal. Your body will fix it because it fixes itself. That's something we don't treat. We don't treat telogen effluvium. We just allow it to fix itself because over time, the phases catch up to themselves.
Like I try to advise my clients behind the chair just to let's be patient with it.
Yeah.
Because a lot of them, they try to go get all of this extra stuff, and I'm like, you
it
taking
more.
all of these extra pills, and then like she said, you ain't got Miranda, like stop,
Yeah.
like stop
Yeah.
doing stuff.
Stop
I get that
Yeah.
you want to do it, but am I accurate in saying like, of course your body's going through all these changes, but by you adding stuff in, is that really jacking up your hormones and doing more?
I agree with you wholeheartedly. No, you need to stop. Just stop. Put the brakes on. I always tell people, if you dig in a ditch, the first thing you do is drop the shovel. Don't keep digging a ditch.
What about when they continue to take the prenatal vitamins throughout longer than?
So basically, your vitamins, you need a certain amount of vitamins, and those vitamins get into your body, and they do their job. If you don't use them, you basically get rid of it. So it won't harm you to take those extra vitamins. The problem comes about is some of those vitamins, like the biotin, for instance.
Yeah, people do.
Take large amounts of biotin.
I'm glad you're addressing this.
They end up with acne. It's because the biotin increases certain functions in the keratin formation, which clogs your pores even more, and now you have acne. So the goal is balance. I tell people to get the cheapest hair, skin, and nail vitamin you can find, because they're gonna put just enough that you need, not all the extra stuff.
So you don't believe in the hair vitamins that are out there that are marketing themselves?
I believe in some of them.
Okay.
BioSeal is one of them that's really great.
Which one? Because people gonna wanna.
It's called BioSeal. The reason BioSeal is great, it's expensive. However, there are certain proteins that allow you to absorb vitamins better, and they actually add that protein into their vitamin. So it's not just like you're taking the medicine and peeing it out or urinating it out. You're basically that's so professional.
That's how you talk to your clients.
Yeah, I'll talk to them straight as I can catch.
You gotta give it to them.
Straight, and they come in, they get everything. I mean, I'm talking the neck snapping and telling them why they didn't want to treat you and everything. But you're basically urinating out the vitamins that you're not using anyway. The fat soluble ones, you have to have certain proteins to even get them. So A, D, E, and K, you have to have fat soluble things. So that vitamin actually puts that in there. Versus just showing it that we have it in there doesn't mean you're going to absorb it. You know what I mean? So that's the technology behind the BioSeal. But then regular GNC hair, skin, and nail vitamins are good too. They have all the essential fatty acids and things in there that they need to produce good nails, hair, skin, and nails.
What about the oils like wild growth oil and Jamaican black castor oil?
So I think oil that is a good question. There's no scientific research on those things. But there is some I would say folklore or I guess superstition and things that we grow up understanding. Our hair needs oil. Our hair needs moisturization. So these companies are taking advantage of that. But it's some truth to what they do. Some of them have very good nutrients. As you guys have the juice bar out there, some of those actual ingredients are in these products. So it's a natural way of helping yourself. And I'm a fan of those oils. But do they have any medicinal properties? I'm not sure. I can't even lie to you. But they do. I do recommend using them because I use oil on my hair. I use regular olive oil out of the supermarket.
Yeah. I like olive oil.
Yeah, olive oil is great.
Okay, so let's get back to her question.
So your question is basically what can be done about your hair. So basically the goal is, when we talked about those hairs pushing out and trying to grow out, the goal for our treatments that we have now is to decrease the inflammation to allow the hair to come out, and we use topical and injectable steroids for that. That's why when you come in, we recommend those things. We also use anti-inflammatory medicines like antibiotics that have anti-inflammatory properties. All those things kind of set the stage for good hair growth, and that's really the best treatment for it. Other than that, I think the better thing to do, like we talked about earlier, is to take the shovel out your hand. Stop the insulting things that's causing the problem. And I always recommend natural hair care specialists. I know people think it's a fluke to come to a natural hair care specialist like, I can do that myself. I hear people say that all the time. I can do that myself. I don't need no $75. Yes, but I'm like, did you go to school for that? Do you take continuing education classes for that? Are you treating, are you getting 10,000 hours? You know, to say be an expert or something, you gotta have 10,000 hours or so. Do you have your 10,000 hours, bro? You know what I'm saying? You know what I mean? Do you have that?
Right.
So that's what I'm saying. So my thing is go to the experts for expert opinion. I'm not gonna take my car to somebody who fixes lawnmowers. I'm taking it to somebody who fixes cars. So I send people to you because I think 10 years ago we sat down and had a lunch conversation.
First it was a phone call.
It was a phone call.
Like,
yeah.
You do hair? I mean, you
you
was
do
like,
natural hair?
I'm looking for
natural hair. Somebody to send these people to, because I got so many clients that I ain't got nobody, because I really needed that help. Because people don't realize, like in the medical profession, you learn about medicine and you learn about the body. They don't teach you about the hair. It's a whole nother ball game. So don't get anybody fooled that the doctors know everything about hair. They're not, unless they're a trichologist, they don't know everything about the hair. All they know is about the skin that's producing the hair, and if we can fix that, we can fix your hair. But a lot of times it's you guys who make the difference. So we can't do it without you. I send patients to natural hair care specialists all the time, and it's because I don't have the tools. I need to know. And I tell them to bring questions. I said, write down questions. I hope they don't come in with it for you.
No, they already got it in their head.
Because I said, don't take a list. Just add, how often do I wash my hair?
Yeah.
What do I wash my hair with? What should I be doing every day? These are things that a whole generation of our people lost. And I'm not going into the black thing. All I'm saying is there's been some things in place that made us think we need to be somebody else. And that whole generation lost that. So we don't know what to use in our hair. We don't even know what to eat anymore. Yeah. And I promise you, if you want your hair to grow correctly, eat the right things. Yeah. I promise you, because I swear to you, I'm a living proof. My hair grew at least 5 inches. I went to Africa for 10 days. I was in a tent. In a hut, and we were living with these people. They had to grow their food. They had to juice. The soup was really ground. I saw them grounding the carrots to make carrot soup. My hair grew so much that I didn't even understand why, and I didn't think about it till I came back. I'm like, man, I've been just eating whatever they picked out of the fields. You know, so it's all fresh. And if you can eat good foods, healthy foods, then your cells are healthy. If your cells are healthy, they can create things healthy. It's just that simple.
So do you recommend like main choice hair vitamins or any other?
I just recommend hair, skin, and nail vitamins. They all have the same ingredients, and it's specific vitamins such as biotin, vitamin E, vitamin A. All these are specific vitamins, that nutrients that you need for your actual hair to grow correctly and nails to grow correctly. Okay. I just recommend being effective, doing your research. I mean, I can sit here and talk till I'm blue in the face, but I want people to take responsibility for their health and for their hair. Do your research. Find the best people in the areas. If Lisa's not it, find the best natural hair care specialist. If I'm not it, find the best dermatologist to treat your problem. But do the research, and then don't because you can't blame anybody because you didn't find it. Right. You know, and ask the experts. You know, people that know what they're doing.
Yeah, a lot of people are relying on YouTube to, feed them on what they should use on their hair because a lot of clients that come to me with hair loss conditions, most of the time, especially if it's breaking off, it's because of the product use that they're using. That's drying it out completely to the point where it just snaps off. They just can't get a handle on it.
You should make them take a picture of the dresser at home. I bet it's product, this much product, right? And they're using it all.
Yep. They got it all on their hair.
Like I use this, I use that,
I use that in the morning.
You got 6 oils. Why do you need all of them every day?
Well, that's the 10 a.m.
No, like people, they will come and they will have like literally a table full of stuff. You just look like, those two are the same. What are you doing? Or they'll come and they'll use the same thing that's drying them out, and I'm like, so you bought another bottle? You bought something else that's gonna dry you out more?
If your hair's not doing better, you still using it?
Like that's crazy. And they'll say, well, can I use the rest of this? Do you want to finish falling out?
Yeah, less is more.
I think it's important to see a natural hair care specialist as well as a dermatologist, because I think a lot of mistakes that people make getting advice from someone else
Mhm.
and thinking, oh well, because it worked for them, it's got to work for me.
Mhm.
And I mean, I have 2 younger sisters, and I know Lisa has seen both of them. All 3 of us use a different hair care product. I mean, and we have the same mother and father. We
Mhm.
all use a different hair care product.
Mhm.
All of us require something different. So it's important to see the experts, as you said. 'Cause
Mhm.
Yeah.
And that's
everybody's
how we
hair is
treat
different.
everybody
Yeah.
that comes in gets treated as they come in,
Mhm.
and that's it. And it's different textures. I tell people I don't know the texture of your hair.
Yeah.
You know what I mean? They know the textures. They know what's right, what's wrong. They know what they've tried for 10, 20 years. You know, so that's what's really important is getting that expertise. That's a really big thing for me. So yeah, I don't. People don't leave out. Actually, you can ask Dre. Dre, I need some cards. Yeah, so we need cards, and I make sure that we give them those cards and direct the people to the experts that I respect. Anyway.
Ananda, I'm a testimony of
Yeah.
what you're actually going through because I experienced hair loss and I was going to Lisa not knowing that they were like, no, they knew each other. And so Dr. Asbury was my doctor. And then one day I went to visit him and he was like, oh, do you have a natural hairstylist? And I was like, yeah, it's Lisa. And it was the same person.
Wow.
But I went through having a biopsy, you know, finding out what type of alopecia I have, and following the treatment that Dr. Asbury suggested, and it took a
I'm sorry
while.
to cut you off. I
That's
hate
okay.
to cut it. Don't call me doctor. Call me
Okay.
DA.
That's
Call me
right.
Mr.
Okay.
Call me Mr. I
Okay.
don't want to.
Did you say Michael or Asbury?
Michael is fine.
All right.
Michael is
That's what I
fine.
said.
You call me Mike. Michael,
All right.
Michael is good.
Okay.
Michael is good.
All right, so we started. So I followed the treatments that Mike suggested, and it took some years to get to where I am. Like I had baldness, but it wasn't permanent damage. But I was consistent. I adjusted a lot of things that what I was using, seeing a professional natural hairstylist, what I was eating. And you know, I was definitely consistent with my appointments. It took years, but I mean, yeah, absolutely.
Yeah.
And I haven't had the shots that I would normally get. I haven't had shots in like 2 years.
Mhm.
Yeah.
So we get there's some success stories, and consistency is important. It's a team effort, as you can see, you know, between me and Lisa working, and then it's her too. Like it took all 3 of us to work that out.
Yeah.
So because you got to be dedicated enough that you want to do it, and you have to be patient, not come in saying, hey, I got patients that come in every week and they go, ain't nothing happening.
Right.
Ain't nothing
It's gonna
happening.
happen overnight.
Yeah, no, it
Right.
doesn't happen overnight. It
Yeah.
takes some
Takes
effort.
time.
And it takes you using your body to actually heal itself. Your body has a natural propensity to heal itself. All we're supposed to do is facilitate that. We're not supposed to damage your body even more. We're supposed to facilitate it fixing itself. So my goal is always to get patients to recognize that. I mean, whether it's hair loss or anything else, my goal is to make sure that you understand that all I'm going to do is help your problem, and your body has to wake up and actually fix itself over time. So, and it does that. Yeah, it does that when you eat right. It does that when you follow the orders of whatever your healthcare provider is telling you, and then whatever your natural hair care specialist is telling you. They've seen the success story. So, like I said,
It's possible.
it's definitely possible.
Yeah.
And what
That was
Lisa
my
mentioned, I
own
went through
question.
the insecurity of, I have a bald spot, and I would, you know, use my other hair to cover it, and I would feel like, does someone else see it?
Right.
And
That's
I was
it.
always touching it, really bringing attention to it myself because I would touch my area.
Yeah.
And so it took me a while to get over it, but you know,
Once it started growing in.
absolutely.
And that's what Miss Lisa told me when she seen me a few weeks ago. She's like, just let it be, you know, don't touch it anymore. Because I just kept
Yeah, now the attention you're giving to
Trying it out,
Yeah.
you getting the hair around, you
Yeah.
digging the hole.
right.
I'm using that.
That's what was
You
going on.
really just
I
digging
was
the
there.
hole.
I admit it. Because it got worse.
digging a
Like, I
hole,
was
like
like,
drop, take the
Yeah.
shove out first.
Right.
Oh.
And I had to
Yeah.
commit to come in and get my hair done because a
Yeah.
lot of people do not want to go and get professional attention. They
Right.
want to do what they can at home, watching
Mhm.
YouTube videos,
I
and
had
I
a lady-
committed to that.
I had a lady tell me today, literally, she just goes in between wigs and getting her hair done. She doesn't even know what happens to her hair. She wears a wig all the time. She said, I don't know whether, I don't wash it all the time. I don't do nothing to it. I don't pay it no attention. The first thing you need to do is pay it some attention.
Absolutely.
It will,
Absolutely.
Your flowers don't grow if you don't look at them.
Right.
You know,
That's
so you
right.
have to pay it
Yeah.
some attention. You have to give it all the things that it needs that you would, care about it. because it really does pay attention. It responds to what you do. So you really should put your effort into doing that.
Okay.
Does stress really cause hair loss?
Oh, stress, that's a broad topic. I'm a believer that stress causes all problems. So you think about, something as simple as eating something that doesn't agree with you. That causes a stress on your body. Your body has has to make decisions every day. I'm checking my heart functioning, kidney functioning, brain, okay, that's cool. This is all functioning. If there's a problem, it has to fix that problem. Well, if you got 10 problems, the priority comes. It says, am I gonna deal with hair, or I'm gonna make sure this lady's heart is working correctly? And if you have heart disease, then your attention goes to your heart and your hair falls out. So stress is actually a big problem. It triggers all the inflammatory things in your body. You realize when you walk past some place that smells good, you salivate? Well, your mouth waters because you thinking about food goes to a hormone and it tells your mouth to water. So when you're thinking about stress, you create stress hormones. And those stress hormones become inflammatory and they cause problems within your body. That's fine for a day, but do it for 10 days.
Yeah.
Do it for 50 years.
Yeah.
You know what I mean? That's what cancer is. You know, do that. You know, you don't get diabetes today. You know what I mean? You don't get it at 40. You get it at 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, up to 40. It's the sugar all those years that makes your pancreas shut down to make insulin. So those things, like, it's not a today thing. It's a everyday thing, and you have to walk the walk, so to say. But stress does cause a lot of issues. It causes every health issue known to man, to me, in my eyes, and that's just my opinion though. And it's from what I've read and learned and studied. The stress is a big problem, so we gotta learn to manage that. You know, if you're getting plenty rest, do you know when your body heals the most? Your body heals at night while you're sleeping. So every hours that you cut off your sleep, you're losing healing time. You know, if your lungs take 8 hours to heal, and you sleep 4 hours a day, COPD's on your way. You know what I mean? So it's just that serious. Like, you got to make sure you get plenty of rest, eat as healthy as you can. I know it's all cliche, but it's really true.
For me, it's really about what's going to work for a client's lifestyle and also what's going to work for their treatment. So I have to kind of sift through what she says. Medically, they have advised her, because some people come in with like topical creams. Some people come in and say the doctor told them to shampoo this amount of times. So I have to kind of listen to that and say, hey, what's going to work? So is it going to be a crochet? Is it going to be a braid? If I know that you already have an issue with tension, why am I going to suggest something that has a braid to it? Something that's going to make you do that. Even when we have clients that come in that don't necessarily have. Sometimes I tell people, I say, okay, we're gonna put your head in the hospital. You know, you just gonna get you a wig. You're gonna cut it down real nice, because they don't have a situation where I'm comfortable putting them in a style that's gonna allow them to thrive and be comfortable being who they are. I tell people, I never want you to go out in public and not feel comfortable. So sometimes if I gotta braid you down, and I got to tell you what to put on. Make sure before you put your wig on, make sure you put your shea butter on. You know, whatever that looks like, just to make sure that everybody has a great experience. Because I know what it looks like. You know, I know what it feels like. Because when you're dealing with people for such a long time, you know, they come to you, and to have a client for 6 years and for something to happen to their hair is like it's mine. Like, I feel like I know Ms. Lisa feel like that's her hair. Like, at the end of the day, like, you might walk around with it, but if something happens to it, it's like